Hello, friends. Good morning, good afternoon, and good evening, everyone. Whoever you are, whenever you are, welcome to Medifine. Today, I want us to look at abnormal uterine bleeding. It is an interesting topic. So, before we go ahead, there's some menstruation, you can check for the body mass index. You look for signs of polycystic ovarian syndrome like hirsutism and acne, and then also insulin resistance, which is also called acanthosis nigricans on the neck, that sign, and perform a bimanual and spectrum exam. So how do you investigate? You can do UPT, FBC, where you check for hemoglobin and platelet. Then you can do targeted screening for bleeding disorders if available. You can do thyroid stimulating hormone and prolactin hormone profile. You can do a pelvic ultrasound, or you can take an endometrial biopsy. Friend, and you can consider hysterectomy. Okay, thank you very much. I request you to subscribe to my channel.